Welcome to Burnout-Free Me, your success and well-being podcast. I'm Dr. Amy Grimm, and I am so glad you're here. Let's go from burnout to breakthrough together. Hello, everybody. Welcome to a very special guest episode of Burnout-Free Me. Today, I'm going to be chatting with Dr. Marie Holowaychuk. Now, Dr. Marie is a veterinary specialist and author and advocate for mental health and well-being in caring professions. With experience spanning general practice, emergency and referral hospitals, and academia, Dr. Marie brings both clinical experience and deep empathy to the realities of veterinary medicine. She is also the author of A Compassionate Calling, a powerful and deeply personal book that weaves candid storytelling with evidence-based research to illuminate the often unseen emotional, ethical, and mental health challenges veterinarians face. Through her work, Dr. Marie helps both professionals and the public better understand the human side of animal care, addressing topics from perfectionism and moral stress to burnout, resilience, and the need for systemic change. Dr. Marie's voice is one of honesty, compassion, and hope, creating connection for those inside the profession and awareness for those outside of it. And while Marie's work is rooted in veterinary medicine, this conversation is absolutely for anyone who loves their work, cares deeply, holds themselves to high standards, and sometimes feels drained by the weight of responsibility. And the themes we explore, like ambition, compassion, burnout, resilience, and what it means to stay human in a demanding career, applies far beyond one profession. This is a conversation about the human side of meaningful work, and I'm so excited to share it with you. So, Dr. Marie, welcome to Burnout-Free Me.
Oh, thank you so much, Amy. It's wonderful to be here with you.
Yes, and I am just so delighted that you are joining us today, and I just have so many questions for you. My first one, of course, is always tell us about you. What is your journey and how did you get to where you are today?
Ooh, such a big question. And,
Yeah.
I think it starts with childhood. I grew up with two veterinarian parents, so I was immersed in the veterinary space from a very young age. I've always loved the profession. I worked at my mom's companion animal practice when I was very little and worked through all the different roles in the hospital. It was a no-brainer for me to apply to vet school. Got into vet school young. I was 19, and I had, ups and downs in vet school, as many of us do. It was much harder than I thought it would be. I was, still quite young. It was my first time living away from home. But by the end of my fourth year, it just really had solidified that I had chosen the right path, and I really excelled in clinics. So I quite enjoyed it. I decided not to join my mom's practice after vet school, so I did opt to do an internship. And so I was accepted to a small animal medicine and surgery rotating internship at Washington State University. So I moved to Washington for a year, and that's where I fell in love with emergency and critical care, which I ultimately pursued specialization in. So I was accepted to a residency program at North Carolina State University, so moved even farther south away from home here in Canada, where I grew up, and loved, loved, loved my residency, loved academia, research, teaching, the clinics, the variability, all of it. And so it was a no-brainer for me to apply for a job in academia. And I ended up accepting a role at the Ontario Veterinary College, where I was assistant professor for 5 years. And I say 4 years because it was really when I hit the 4 year mark that I didn't know it at the time, but I had really started to experience burnout.
Mm,
And it just was feeling unsustainable to me. It was literally my dream job. I loved every bit of it. And I felt like I was struggling and nobody else looked like they were struggling. And I thought, what's wrong with me? I'm not cut out for this work. And I was missing home a lot as well. It's about a 4.5 hour flight from my family and friends out west in the other side of Canada. And so I made the really difficult decision to resign. And I think had I known then what I know today, maybe I would have made a different decision. But nevertheless, that set me on a path of being an entrepreneur, being a locum, a critical care specialist, a speaker, a consultant, and through many additional bouts of burnout along the way and battling my own perfectionism and mental health challenges, I ultimately found the tools and strategies that really helped me to be able to lead a balanced and fulfilling life, both professionally and personally. And so that actually dovetailed into what I do most of the time today, which is well-being and mental health advocacy.
mhm.
So I started offering retreats back in 2016. When we arrived at the pandemic in 2020, it was just when I had had my daughter. And so I had morphed into more online learnings, online programs. And then that has since morphed into additional resources and coaching and debriefing and lunch and learns through Reviving Veterinary Medicine. So I have Reviving Veterinary Medicine, which functions as a well-being platform for veterinary professionals. And I continue to speak. I wrote a book recently, and I still continue to practice. I love veterinary practice. I'm not ready to give it up yet. And so trying to juggle all of these things and find what fits best in this season of my life as a mom to a 5 year old and somebody who is very multi-passionate in this space. And I think that about sums it up, Amy. I could keep going, but I I think that's the basics of it. The Coles
Yeah.
notes.
Yeah, no, that is just such a beautiful story. And it's also, it highlights why I was so excited to have you as a guest because
Mm,
your history and experience is so rich, not in just all the different facets of vet med that you have been in, but also in life, as a
mm,
woman, as a mother,
mm,
as somebody
mm,
who has different types of passions, who is deeply invested and cares deeply about her career and
mm,
also serving others, right? We get into veterinary medicine because deep down, we want to help. And
mhm,
I think there's so many high achieving women, veterinary professionals, caregivers out there,
mhm,
whether they're inside or outside of veterinary medicine, who can really see parts of themselves in your story.
mm,
And I guess I'm kind of curious, like what lessons from your journey so far do you
mhm,
think extend, beyond one profession, beyond veterinary
mhm,
medicine?
mhm, mhm. Such a great question. I've given this a lot of thought because, similar to you, I have a deep desire to help as many people as possible. And when I wrote my book, I really wrote it for pet owners who are caregivers as well, right? And we know that pet owners as caregivers, especially when their pets are sick, they have their own caregiver challenges too, just like we do in the veterinary profession. I think when I consider caregiving professionals who are in professional roles like doctors, nurses, therapists, et cetera, one of the biggest lessons, certainly, that I learned early on was this need to really prioritize taking care of ourselves. And I don't want to dismiss the impact that our environments can have on us. There's certainly lots
Mhm.
of challenges in terms of the systems in place in vet medicine that don't make it easy for us to maintain our mental health and well-being sometimes. And I also one ability for the role that I play in the decisions that I make. And
Yes.
we're so used to taking care of other people that I think it feels uncomfortable and odd to take care of ourselves. And I've learned, especially, and as a veterinarian, if I am not taking time to take care of myself, whether that's setting boundaries, getting enough sleep, having good nutrition and hydration during my shifts, practicing mindfulness so that I stay regulated, then it really shows up in the work that I'm trying to do as a caregiver. That's when I make mistakes in my job. That's when I'm short with my daughter. That's when I'm snippy with my partner, whatever it might be. So, really holding on to what maybe feels a little bit cliche, but this notion that flight attendants remind us of every time on an airplane, you have to put your oxygen mask on first before helping. So hard. It's so hard. And I can't imagine being on an airplane with my daughter and not wanting to tend to her first. And,
Hmm.
there's times when I'm on shifts in the ER and there's a patient that really needs me. And I just recognize I have to step away or I'm not going to be able to think properly to help this case. So I
Hmm.
think holding on to that has been really important. I mentioned a couple other things that are of importance as well. I think perfectionism is a big one. I've had some significant struggles with my daughter over the last couple of years and, building a business and, just having this perfectionism so ingrained and wanting everything to be perfect. And at the same time, recognizing the deleterious impacts of that on, for example, the relationship with my daughter when I get frustrated when she's not acting a certain way or listening to a certain degree, or in my work when things aren't exactly perfect. And I've learned that progress is better than perfection. Starting something is better than putting something off until it's perfect, because that's not possible. And just having a little bit more self-compassion and grace, I think.
Hmm.
And that relates probably to one of the last things I would say. Of course, there's many, but a big one too has been recovering from mistakes. I
Yes.
think we're human, we make mistakes, and I didn't quite understand that until I was into my residency training and I made a mistake that caused the death of a patient, and I wrote about it in my book because it's had such a lasting profound impact on my life and my career. And I've made some mistakes as a parent as well. And we can sit here and berate ourselves for that and, try to do all these coping strategies so that we think that's going to help us from not making that mistake again.
Hmm.
What I've learned is that can keep you so entrenched in a place of shame and stress and overwhelm. The sooner that I can get to a place of self-compassion where I can be kind to myself, I can accept the situation as it is, I can notice my struggle and my suffering, but not cling to it, and recognize I'm not alone, that we all make mistakes and we're all human and we all have the best of intentions. And yet, still, we find ourselves in these situations, and that's okay. And talking to myself more like I would talk to a good friend or my daughter, if she had made a mistake. So I think those are the biggest ones. I wonder
Hmm.
what you think, Amy. What comes up for you?
Yeah, no, you have covered so many good bases. I think, just listening to your story, parts that I recognize within myself are things like perfectionism.
Mm-hmm.
And one of the things that I find really interesting is there's so many of us who have these perfectionist tendencies, but don't necessarily identify ourselves as being perfectionists because our life looks like a hot mess, right? Like, there's like so many things going on. The kid's not listening, things aren't going right at work, my schedule's a mess, all of this. And, what you said really about being able to accept things for how they are, not necessarily in a way that doesn't mean you're not going to advocate for yourself or make
Mhm.
healthy, sustainable changes, but more from that, like, I don't have to be so hard on myself. I don't have to
Mhm.
hold this so tightly. It's okay to let go. I
Mhm.
think that is such a beautiful way of showing ourselves self-compassion and, like you
Mhm.
said, speaking to yourself like you would a good friend or your daughter,
Mhm.
or in my case, it was my pug. What am I going to say to Burkles?
Aw.
Yeah, my little buddy. Oh,
Aw.
yeah. And I think, yeah, that drive that so many of us have, we
Mhm.
tend to be high performers or high
Mhm.
achievers in these types of fields that, just internal drive sometimes pushes us past the point of recognition where we start sacrificing ourselves and our well-being without
Mhm.
even realizing it.
Mhm.
Yeah, I think those are some things that I very much identify with and also see in many of the women with whom I work.
Mhm.
Yeah, yeah, and I'm curious from
Mhm.
your perspective because I mean, you've touched on so many things already, like perfectionism, and
Mhm.
even in your book, you talk about moral stress and
Mhm.
identity, which I really love. I think being able to disentangle our identity is a very big step towards leading a more fulfilling life. So when you're thinking of like these high performers or high achievers in their
Mhm.
fields,
Mhm.
how come we seem to be more at risk of burnout or experiencing that sort of dissatisfaction even when we love our work so
Mhm.
much? Like it
Mhm.
seems like two opposite things sometimes.
Yeah, it's such a great question because I have found myself in this particular season of my life feeling many symptoms of burnout and which is, maybe ironic as an advocate and somebody who's versed in the research and the tools and strategies for preventing burnout. And yet it's so complex and so multifaceted that I think there's so many ways in which we can get there. When I think of caregiving professionals in whatever capacity, it can be the load, the workload, it just there's too many things on your plate. There's too many directions you're being pulled in. If you're in practice, there's your caseload is too high. There's too many clients, maybe clients, especially with special needs, that are really pulling on you. Not having control over our workload is a big precursor to burnout. And I feel like there's so many things in my life I haven't had control over recently. I've been waiting on a house to get built that's 4 months behind, and that's out of my control. And, other facets of my business, I've been traveling and delays are out of my control. Working through some challenges with my daughter that are out of my control. That really wears on a person over time.
Hmm.
And, there's many other factors, not feeling recognized or rewarded for the work that we're doing. I think that when we're working so hard and not feeling that it's being appreciated or recognized, or maybe we're not getting compensated enough for it, I think that that can have an impact as well. And many other things for those who work in workplaces with a lot of other folks, relationships and challenges at work in terms of toxicity or conflict, can also have a big impact as well. And then, of course, from a personal perspective, when we're working multiple jobs or we have multiple caregiving roles, whether it's for parents, children, partners, jobs, pets, that can all add to it. And not having that separation, working all the time. I'm in a season of my life where I can work a lot while my daughter is at school, and she's only at school for so long. And sometimes I need to do more work. So I find myself working in the evenings and on the weekends. And when that work seeps into the rest of our lives, that can also be a precursor to burnout as well. So, to answer your question, Amy, I think it's just there's so many different factors. And I think when we are high achievers, when we are so passionate about what we do, it's hard to say no. It's hard to set limits. And I know for me, I go through periods of like, I've got to take myself off some of these committees and I can't volunteer as much. And I've got to let go of this project or I've got to postpone that. And then we do that. But then, we overestimate what we can take on. And so then we take on more again. And then again, we find ourselves in this space of overwhelm. So I'm in the throes of it right now. I'm definitely in a space of what needs to shift so that I can be in a better frame of mind and a better energetic capacity moving forward. And so I think to all the other women, especially who are juggling a lot of these caregiving duties, I get it. We
Yeah.
understand, even though we're experts at this, so to speak.
I know. And one, thank you for being so open and vulnerable. And two, also for bringing up this idea that somehow, as coaches or people in the mental health space, that
Mhm,
we somehow have it figured out
mhm,
and that we are now immune to these problems or we don't
mhm,
experience burnout anymore. And yeah, even though this is something that I help other women with now. Like,
mhm,
just like you, I also experience those times where I can recognize, like, oh, I think I've pushed myself a little too far right now. And, there's so much peace now compared to, like 10 years ago, where I would have pushed harder to try and
mhm.
outwork, the problems or catch up or just do one more
Yes.
thing. And, the journey is more about being able to recognize when we're slipping into those kinds of patterns and
Mhm,
catch it a little bit earlier. Maybe not
mhm,
at first because it is a skill and it takes practice and,
mhm,
being kind to ourselves when we do.
mhm,
But I think it kind of speaks to those perfectionist tendencies that you brought up earlier, where it's very easy to fall into that trap of like, oh, if I were doing it right, then I would never experience burnout and I would never have these problems. And, you know, that's
mhm,
just not true. Like, life is gonna
mhm.
life.
Yes, life is gonna life. I love that. So true.
Yeah. Yeah. And do you think, there's some, maybe internal narratives that women carry that also make them, higher at risk or, more likely to experience these kinds of effects?
Hmm. Yeah, I think we're very good at shoulding on ourselves. So
Yes.
I'll the using overusing the should to be clear to everybody. I didn't swear, I promise. Um, there are just so many expectations, and I don't know if those expectations come from society or just the pressure, just the pressure that we innately put on ourselves, again, as high achievers, as passionate individuals that want to do a lot and be there for everybody. But I do feel that there is this, I should be able to hold it all together and I should be able to have this incredibly put together household and family and career and social media presence and whatever else it is. And I think that's a big contributor. That's something that comes up for me. I think the shoulds then lead to the shame, right? Because it's inherently self-judgment where you have some expectation for yourself that you're not meeting anytime you use the word should.
Hmm.
And then for me, especially as somebody who's very prone to shame, that very quickly devolves into what am I doing wrong? What's wrong with me? I'm bad at this. That headspace. And then, of course,
Yeah.
when you find yourself in that headspace of shame, it can be hard to pull yourself up out of that because that's very isolating. When you feel like there's something wrong with you or you're different or flawed in some way, it prevents you from reaching out and from sharing. And again, when it's compounded by the fact that I'll use the should word again, I should know this by now. I teach this stuff for a living,
Yes.
I should be able to have figured this out. And it's just a vicious cycle,
Mm.
essentially, is how I see it.
Yeah. And I think these kinds of narratives that we tell ourselves, They tie into something that you touched on in the book, which is this hidden curriculum that we can
Hmm.
sometimes experience in vet school. And
Hmm.
I was curious if you wouldn't mind expanding on that a little bit for us today.
Yes, I would love to. The hidden curriculum is the curriculum that we are taught that isn't formalized. So when we think of the formal curriculum, this is like what you have in your syllabus, right? Like what they say you're going to learn over the course of the year. And then we have what is actually delivered to us in the classroom with presentations and labs and so forth. The hidden curriculum often shows up, especially in our fourth year when we're actually in the clinic and we observe the actions of our mentors and professors. And we see when real life sets in what people are actually doing. And that often conveys a message or a curriculum very different from what we were formally taught. And I think the hidden curriculum in vet school really pushes us to feel like we, just like you said, I think a moment ago, Amy, you just kind of power through. You keep your nose down, you power through, you work through it.
Mhm.
You have a tough case. Okay, now moving on to the next thing, that there isn't room for burnout. There isn't room for, at least there's room for burnout. And I think almost we've reached a point in vet med where we feel like burnout's inevitable. Like you will get burnt out, which I don't
Yeah.
think is a very healthy mindset either. But that when you do burnout, there's no time for that. You just have to power through because that's what everybody does. And so we even hear this from students in school who say, "Well, I couldn't possibly take time off for a mental health appointment because my rotation mates might think I'm lazy or weak." And that hidden curriculum is very damaging, and it doesn't help us when we're trying to make the profession healthier, for sure.
Yeah.
And I think that hidden curriculum is pervasive in healthcare professions. We are the
Mhm.
caregivers, we power through. If we can get through COVID, we can get through anything, whatever the sentiment might be. And that really prevents people from seeking the help they need when they feel burnt out, or
Mhm.
saying no or speaking up that, hey, this isn't working for me.
Yeah. Yeah. And I think it's such a common theme, in so many high achievers and, people with high responsibility roles.
Hmm.
I am the go-to person. I am the one people come to figure it out. I'm the one
Hmm.
who says yes and makes it happen. And, I see so many parallels between, veterinarians and then like yourself, small business owner, entrepreneur,
Hmm.
people in corporate fields.
Hmm.
I just gave a presentation to financial advisors 2 weeks ago, and
Hmm.
it was just like so good. I'm going to say good in quotation marks to really connect with them on that human
Hmm.
level and know that, you know what, we're all kind of facing the same battles here.
Hmm.
And, yeah, I don't think the narrative that burnout is inevitable is a healthy mindset. I think
Hmm.
there are ways for us to advocate for ourselves and also to advocate for healthier professions.
Hmm.
And I also think we sometimes fall into this trap of the shoulds, like you mentioned, what a successful career should look like, or
Hmm.
that external validation from other people. And I guess I'm a little curious, how has your own definition of success changed over time? Because I know mine has changed a lot over the last 10 years.
Yes. Oh my goodness, for sure. I mean, 10 years ago, a little over 10 years ago now, when I was in academia, success would have been achieving promotion and tenure and publishing three or more papers a year and, supporting X number of graduate students and maybe getting an award or something like that, a teaching award. And not to, downplay the importance or the just the wonder of those different things. I think those are amazing. And it's great for us to have goals. I think success for me at the end of the day today, fast forward 10 years, is when I can live a life that allows me to do the work I love without being at the expense of my mental health and well-being.
Yeah.
And that includes living a life outside of work that allows me to stay connected with my friends and family and have authentic and meaningful experiences, whether that's through travel or whatever it might be, all while embracing health to the utmost degree. I mean, we only have one body, one brain to carry us through this lifetime. And health is, I've come to recognize that it's one of my core values. Connection is one of my core values. So for me, it really is about living a life that allows me to stay in alignment with those core values and feel like I'm making a difference in the world,
Mhm.
which is, of course, also another core value to feel impact and meaning,
Yeah.
right? So
Hmm.
there's so many different things, Amy. It's like meaning and purpose, which I think is
Hmm.
necessary for so many of us as humans. It's health and well-being. Um, it's hard for me to put into words, but that's
Hmm.
what's coming up for me.
Yeah. Yeah. And I like how you really bring up this idea that we can have both. Because I really
Hmm.
think that sometimes we believe, oh, to have the successful career and to, achieve those things like you were talking about, the tenure or promotions or awards, that you
Hmm.
have to sacrifice yourself or your family or your free time.
Hmm.
And I think being able to open up to the space of, no, actually, I can have both. Maybe it's going to look a little different, or I'm going to have to like
Hmm.
reevaluate, my values or, how I want to align my career and all of these other things with my life. Like, I
Hmm.
think, that is really the whole point, right? Is to be able to have this whole fulfilling life for a whole human being. You're not just
Hmm.
one particular role. We are so many different things. And that kind of
Hmm.
brings me back to, what you had talked about identity wise, can you maybe explain a little bit about, identity versus like a role in your life and how that
Hmm.
sets you up for success and sustainability when you can, you
Hmm.
know, make room for all of that?
Hmm. Yeah, identity is one of those things that I've also put a lot more thought into recently and recognized. I think the first time I realized how perhaps unhealthy my professional identity was when I thought about resigning from my job at the University of Guelph at the Ontario Vet College. I just felt lost. It was like panic inducing. Like, who am I if I'm not assistant professor of emergency and critical care? Like, who would I? Yeah, I just felt totally untethered because so much of my life was wrapped up in that. And it's interesting because a few years later, I did an exercise where I wrote down all of the different roles that I have in my life. And, I try to think about this on a regular basis even today, mother, daughter, sister, friend,
Hmm.
mentor, coach, caregiver, pet owner, poodle lover, like whatever it might be, all of these different things, just to recognize the richness of the different roles and identities that we have and can play, and to not become so wrapped up in one as being the all encompassing. And I think that is a challenge for many veterinarians. We don't think of ourselves as getting a degree in veterinary medicine. We think of ourselves as becoming a veterinarian or a veterinary
Hmm.
professional. And then it's hard to see anything outside of that. And then when you start to have challenges in your role as a veterinarian or whatever caregiving profession you are, it can feel very destabilizing because it can feel like there's nothing else. And I think
Yeah.
even within the veterinary space, when I was researching for the book, there's a lot of research to demonstrate that even being mindful of how you develop your professional identity as a veterinarian can have a big impact on your well-being and your mental health. They recognize that vet students who identify as diagnosticians, their job as a veterinarian is to diagnose it and treat it, that they tend to have lower well-being scores, especially in the face of challenge or conflict at work, compared to those veterinarians who identify themselves as problem solvers. Like, I'm
Mm,
here to solve problems, whether it's a difficult case or whether it's a challenging client or whether it's an issue with my business in practice ownership. I'm a problem solver. And
mhm.
they tended to have much higher levels of mental health and well being. And so I find comfort in identifying myself as a multi-passionate individual. It gives myself permission to have a lot of different interests, to wear a lot of hats, to um, have a lot of different roles and identities and not feel so ingrained in one thing. I hope that makes
Yeah.
sense.
Yeah, absolutely. And when something is so closely tied to your identity, and I mean, it can be any kind of label or role, whether that be
Hmm.
your job description or, being a mother or a spouse or
Hmm.
something, when something happens to challenge that, it almost feels like your own self-worth or competence or belief, in yourself is being challenged and put on the line.
Hmm.
And I think
Hmm.
that's what makes it feel so destabilizing and shaky. Whereas when you're able to recognize, what these labels are versus like, who am I as a person? I'm a
Hmm.
multi-passionate person. I'm a problem solver. I'm somebody who, is curious or loves service. Like
Hmm.
being able to
Hmm.
talk to yourself in that kind of language can be so much more helpful in, just helping to
Hmm.
kind of release the reins a little bit, so to
Hmm.
speak. Yeah.
Hmm. Yeah,
Yeah.
I
And
couldn't agree more.
for me, it was also stepping back from being a full-time veterinarian and a medical director
Hmm.
to then go
Hmm.
tell like my colleagues and my friends and my mother that like, oh, you know what? I'm gonna be a life coach now. That I tell
They're like,
you,
I'm sorry, what?
yeah, is that a job? Like, yeah, girl, that was one of like the most like destabilizing moments.
Uh-huh.
Oh, yeah. And I can like,
I remember when I did my
yeah.
yoga teacher training, I think it was back in 2015, and
Hmm.
people were so confused. They were like, "So are you going to be a yoga teacher now?" And I was like, "Well, I'm
For
just doing my yoga
veterinarians.
teacher training. Like, I'm not, again, it's like, are you still a veterinarian?" Yeah,
Yeah.
yes, that is part of me. That is part of what I do. I think that's the challenge with us as veterinarians is that people, even growing up, I remember my parents like that whenever anybody asked what I was going to do when I grew up, they were like, well, be a veterinarian, of course, like it's like
Yeah.
there's nothing else. And
Yeah.
it
You
just,
like
then it's about
animals,
getting into
duh.
vet school. Yeah, and it's like, and then it's just about getting into vet school, and then after vet school, it's like, are you going to be a practitioner? Are you going to own your own practice? Or where are you going to practice? And it's very linear and it's very
Hmm.
confined. And I think it would really serve us well and all caregivers, whether, like I said, you're a physician, a nurse, a occupational therapist, it doesn't matter. There is more to you than what you do. That is a part of you. That is your job, or that is your chosen career path. And um, that's maybe your one of your passions. But that is not all of you. That is not the whole you. Yeah.
Yeah. Yeah. It's so crazy to think that, like, yeah, actually, I can be both. Like, when at the time it really felt like, I was just being ripped apart, right? Like,
Hmm.
the who am I that you talked about.
Hmm.
Yeah.
Hmm.
Oh, man. So thank you so much for bringing that up. I think so many people are
Yeah.
just, yeah, they really, we as women need to hear that we can be all of these things and like we can
Hmm.
also be there for ourselves just because we are multiple
Mhm.
things to multiple other people or passions or things like that doesn't mean that you lose you in the process, which, yeah, I think was a very big piece of the puzzle for me, and certainly with a lot of the women that, I get to coach and
Mhm.
work with now. It's like,
Mhm.
how do I be me and still do all of these amazing things with my life? Because, yeah, I care deeply.
Mhm.
Yeah.
Absolutely. Mhm.
Yeah, and I want to bring it back to the book for a minute.
Mhm.
One of the closing chapters that you wrote was about paving this path to self-care and self-compassion,
Mhm. Mhm.
which I think is such an important piece and also one that maybe we tend to like ignore or push aside
Mhm.
a little bit.
Mhm.
So for, like high responsibility professionals, what
Mhm.
does this actually look like? Because we talk about it
Mhm.
all the time, but for some of us, it's like I don't even know what that is. Can you help me
Mhm.
understand?
Mhm. Absolutely. It goes back to, I think, one of the first questions you asked me, which is one of the big lessons that I've learned. And it's definitely that we need to take care of ourselves to do all of our caregiving roles.
Hmm.
And it is important to recognize, I think, the difference between self-care and coping strategies. Coping strategies
Yeah.
are something that are okay in the short term if we recognize them for what they are. So it could be getting home after a really, really, really hard day and putting your feet up, pouring a glass of wine, eating your takeout, and watching Netflix. Maybe that's all that you can do that day.
Hmm.
And coping strategies every once in a while in a time of crisis or in a time of hardship, I think are okay. However, it's not self-care, right? Self-care, we want to think of this as being health promoting, something
Hmm.
we do for ourselves, something that we do to fill up our reserves so that on those really depleting hard days, that maybe we don't necessarily feel like all we can do is come home and pour a glass of wine and turn on Netflix, that we have the capacity to maybe do a light yoga class or go for a walk or phone a friend or
Hmm.
whatever it is. So I try to think of self-care in a very holistic way in terms of recognizing it's not just about what we eat and how many hours we sleep and how much we exercise. It's everything from our physical, emotional, social, financial, intellectual, environmental, and spiritual well-being. And so being very intentional about it, being intentional about recognizing what do I need to feel like a whole, healthy person,
Hmm.
and setting goals and strategies to be able to do that. And it's not always fun and enjoyable. I mean, I don't know about you, but I don't love booking appointments with my therapist, but I know that that's what I need to be able to manage my anxiety and
Hmm.
my depression and going to my physician once a year so that I can do all my annual screenings and meeting with my financial advisor in the new year to talk about my taxes and all
Uh-huh.
of these things. I mean, this is not fun. This is not bubble baths and chocolate cake,
Hmm.
but these are self-care, health promoting strategies when we think of that. So I think that is really, really key to be mindful of and very intentional about. The self-compassion piece, I mentioned it before, is recognizing, and I think this is so important for high achieving individuals. And I actually had a conversation with a psychologist who researches self-compassion recently, and she was telling me that for individuals like us that are very intellectual and very high achieving, doing cognitive behavioral therapy, which is a form of therapy many of us do and I have done for years, is actually not always helpful because it's just more to kind of like focus, like get our heads straight on. And okay, now
Hmm.
this is another thing I have to do. And what they found in their research is that the self practice of self compassion is actually a faster and more effective way
Mhm.
to restoring mental well-being compared to cognitive behavioral therapy, because it is a simple practice of being kinder to ourselves, recognizing we're not alone, not hyper fixating or ruminating or dwelling on something, but just noticing it and then moving on with kindness and concern. And so that's been a really big focus for me. There's also a lot of research to show that the two of them go very well together, such that those individuals that practice self-compassion are much more likely to practice self-care. And I think it's because it's like we give ourselves permission
Yeah.
to step back. Setting boundaries is a form of self-care. And so we give ourselves permission to say, you know what, I don't have the bandwidth to do that right now. Or I need to take care of myself today. And
Mhm.
then tomorrow I'll get back to helping you or whatever it might be.
Mhm.
So I think those are the biggest things to share. They're topics I'm very passionate about, and again, I think are so applicable to everyone, women especially, and
Mhm.
caregivers especially.
Yeah. And I think, I mean, that was just such a beautiful, expansive, all-encompassing way of, talking about it because it's very easy for us to get caught up in that checklist of, like, oh, I went to the gym, check. Oh, I ate a healthy meal, check. And then on the flip side, beat ourselves up when we don't get all of that self-care checklist
Mm-hmm.
completed. And, just when you were talking about, yes, seeing my financial advisor is self-care and like going to therapy. And for me, it's like I have to remind myself when I get up, to go to the gym in the morning. It's like this is a
Mm-hmm.
form of self-care. Maybe my
Yeah.
body doesn't love that I'm getting up at 6 o'clock. And at the same time, once I'm up and moving, it's like, oh yeah, like I actually enjoy this movement and this physical nourishment. And there's just
Mm-hmm.
so many different ways of thinking about self-care instead of just all the stuff we see on social media and like
Mm-hmm.
bubble baths and coping mechanisms
Mm-hmm.
like drinking a glass of wine. For
Mm-hmm.
me, it really came back to what did I need in that moment?
Mm-hmm.
What was I lacking? What could I offer to
Yeah.
myself? Because ultimately, if I come home at the end of the day and I'm craving that glass of wine just to relax, like I
Mm-hmm.
don't have a red wine deficiency. It's that is not the need, right, that I'm meeting.
Yeah.
So really being able to get curious and
Yeah.
kind of dig a little bit deeper and say like, okay, well, what is it that I need? And I think that
Mm-hmm.
really dovetails into what you're talking about with the self-compassion. The more you care for yourself and show yourself self-compassion, the easier it is to get more curious and to dig deeper and take better care of yourself. And yeah, it's really
Mm-hmm.
just that snowball effect, for lack of a better word.
Mm-hmm. Mm-hmm. I love that. I love that. I think tuning into our human needs is so important on so many levels, whether you're in conflict with somebody and you're upset with somebody, you're judging somebody, there's probably an unmet need there that may
Hmm.
be a boundary. It may be a need for self-care, just a need to communicate something, but I love that. I love that coming back to our needs. Hmm.
Yeah. Yeah. Dr. Murray, thank you so much. This has been such a delightful conversation today. And yeah, I feel like we've covered so many important things, and I can really see myself in a lot of your story. And, I'm sure there's so many other women who can too. And I'd like to wrap up by asking you, where can listeners find you, connect with you, get your book, all of that good stuff?
Oh, thank you so much, Amy. This has been a real pleasure. And yeah, I would love for people to visit my website if you're curious to learn more. It's my name, marieholowaychuk.com. The book is A Compassionate Calling, what it really means to be a veterinarian. You will find information about it on my website, or if you go to a compassionatecalling.com, there's information just on the book itself. And I'm on social media, Instagram, also my name, LinkedIn. So, all the usual places, always happy to connect. I share lots of resources. So, even if you follow me, you'll be sure to get some tools and strategies that can be helpful for you. So, thank you again for having me on, Amy. This has been awesome.
Absolutely. Thank you so much. And I'll make sure to put those all in the show notes.
Wonderful.